My name is Jessi Bon, and I am the City Manager for the City of Mercer Island. Today is Thursday, March 26, and this is our live situation briefing. As a reminder, we do record this briefing, and it will be available on our website either later this evening or first thing tomorrow morning. We have quite a bit to cover today, and on the screen, I will walk through the list of items we plan to cover today. First of all, I'm pleased to announce that Dr. Hal Quinn from Mercer Island Pediatrics is here with me today. He'll be talking about his role as our emergency medical director. I do have a number of slides. I'll be covering the confirmed cases on Mercer Island. We have an emergency management operations update. We also have an update on city services, including police, fire, and an announcement about the next city council meeting. And finally, we will be talking about ways in which you can support small businesses and a specific call to action for the City of Mercer Island. Before I turn it over to Dr. Quinn, I just wanted to mention the Mercer Island School District will be meeting tonight at 5 p.m. Actually, excuse me, they have a 5 p.m. executive session and then a public meeting at 6 o'clock. You may recall that Superintendent Donna Klosky joined me at the last two briefings, so she is not here today, but please tune in to their meeting at 6 o'clock. And I also want to take this opportunity just to say thank you to the Mercer Island School District. I know you may not be seeing everything that's going on behind the scenes, but we are well coordinated and working together on the emergency response. So thank you, Superintendent Klosky, to the school board, and to all of the staff. All right, it is now my pleasure to introduce to you Dr. Hal Quinn. He is the medical director for the Mercer Island Emergency Response. And as such, he is going to be talking with us today about a number of things, including his insights and observations, what you should do if you are sick or if your child is sick, and covering some things that the Mercer Island community can do to help our medical professionals right now. Dr. Quinn, welcome, and thank you for being here. Would you start by telling us just a little bit about your role? I know you personally because you are the pediatrician for my children, but you play another role in the city as our emergency medical director. Can you tell us a little bit about what that is and what you do?
Of course. For the last 3 years, I've been meeting with a group of volunteers on Mercer Island, trying to prepare our community in the event of a disaster. The typical scenario has been the Cascadia subduction earthquake. But big windstorms have also created scenarios in the past where there's been a stress on the community and our first responders. Infectious disease has not been left off that agenda, thinking back to the 2009 H1N1 outbreak. Officer Jennifer Franklin of the MIPD is our lead. Sections in the volunteer group include not only medical and nursing, but also child care, animal shelter, transportation, administration, neighborhood preparedness, that's the Map Your Neighborhood initiative, sheltering, mental health, well operations, which is our emergency water supply, and ham radio communications. I'm on that group as well. Beyond my role here, I've been serving for the last few years on the Washington State Disaster Medical Advisory Committee. It's a pretty high-level group of people, well above my pay grade. I've been meeting with them biannually. Our job is to advise the Washington State Health Officer, that's Kathy Lofi, you all have probably seen her on the updates and briefings with Governor Inslee, and the Washington Secretary of Health on disaster medical topics such as scarce resource allocation, surge mitigation strategies, crisis standard of care planning and implementation. All that stuff means when the bad stuff happens.
Thank you very much. I know as a physician on the island, the Mercer Island Pediatrics office, you have had to modify your operations, as have many other healthcare providers. Can you tell us a little bit about what the operation looks like, what we should expect if we do need to reach out to you for services?
Each one of us has our own personal and professional challenges during this crisis. At my medical clinic, we are considered essential and we must remain open. Children still need to be immunized, and there are many illnesses that need to be managed and addressed. We're triaging patients by phone to keep them out of our clinic if they don't need to be there. We've made significant logistic changes in our clinic to segregate the well from the ill, with separate entrances to our building for each one of those categories, and also acknowledging, of course, that well children can be infected with coronavirus. That's one of the interesting things about kids is how they can look healthy and yet still be carrying that virus. With all this in mind, we've been minimizing the amount of time that people stay in waiting rooms, which is also a little strange for some people to hear sometimes. But we're trying to get them out of those waiting rooms, areas, into exam rooms. We also have the fortune of having two sides of our clinic. I've always called that the East Bank and the West Bank. We're seeing sick kids on one, children who are asymptomatic on the other. And you can imagine we're wiping things down. I was going to use the term, there's no tomorrow, but that would be a really bad term right now. Any case, we've tested 16 asymptomatic children. We have been fortunate to have some test kits. We've found no positives as of yet. I heard last week there'd been a couple of cases on Mercer Island in the assisted living facilities. I reached out to one of the directors because she's on my medical nursing team, and it sounds like that case may have been off the island in a sister facility. Ms. Bon may have some additional information on that later.
Absolutely. After we conclude here, I will be updating the community on the number of confirmed COVID-19 cases we have here on Mercer Island. I think I just want to emphasize what you said. We've repeated it in our past presentations. If you need to be seen by a physician, call ahead first. That's very important. Moving on, and I was mentioning before we started this broadcast that as my kids have been biking and scootering and doing all sorts of fun things, they've had falls and scrapes, and I've been thinking, oh my gosh, we're trying to stay out of the doctor's office, but they're kids. So what can you tell us specifically about what we should do if our kids are sick, particularly with symptoms that look like COVID-19?
Mm-hmm. All right. So COVID-19, or COVID-like illness, CLI, looks a lot like influenza for many people. That virus, influenza A, is still in circulation right now. Fever, sore throat, significant fatigue, and malaise. Malaise means feeling really crummy, and cough are common symptoms. Some children will have gastrointestinal symptoms as well, including vomiting and diarrhea. Many illnesses, including mild coughs and fevers, can be managed at home. Fever and sore throat with little congestion or cough could be strep throat. We're going to want to see that. But again, please call us. We can triage that and determine if you need to be seen. Do contact your health provider for guidance in that regard. Additionally, and of course, always call 911 if you feel that you have an emergency.
Perfect. And we do want to emphasize that. I know early on in the emergency response, people were hesitating to call 911, but it is there for you to call in the event of an emergency. Tell us, Dr. Quinn, what can we do to help you right now and other medical professionals?
We no doubt sound like a broken record. Now, some of those in the audience may not get that analogy. Ask your grandparents what that means on Skype or FaceTime. But we're repeating the same message over and over that you've been hearing on television. Stay at home. Wash your hands. Don't touch your face. This is hard to do, by the way. I was on a Zoom call with a bunch of docs last night, and you can see many of the docs who have cameras, and it's amazing how many doctors spend a lot of time with their hands on their face to do the best you can with that. Actually do get outside. The weather's good, the days are longer, but please keep your distance. Many of you may have seen the images from Rattlesnake Ridge last week. There must have been 400 people up there. Alki Beach was just covered last week. We want you people to stay away from each other. Have fun, enjoy your time outside, but please do stay away from each other. This is a big one for me. The Mercer Island community has been extraordinarily generous with the care of our clinic. We've just sent out over 15 thank you cards to individuals and dentists who've been kind enough to provide and donate masks, hand sanitizer, and gloves to our clinic. If you have these supplies and you feel you can part with them, we are still accepting donations. If we don't feel we'll need them, we will get them to others. I'm going to add something that I didn't send to Jessi last night, but the conference call I was on last night was with Ms. Lofi from the State Department of Health, and it was many, many physicians clamoring for more personal protective equipment. We must have ways to protect our healthcare providers, and I think I'll just take one little sidebar on that. I also was on a conference call with Children's Hospital this morning. They've got 2 kids hospitalized, I believe, with COVID-19. They have 24 healthcare providers sick. Also, I want to say this in reference to the fire department. Last night's call, during that call, one of the firefighters from the east side, I believe, was looking at whatever you guys look at to know what's going on in the community. There were 7 calls ongoing at that moment to COVID-positive patients for our firefighters. And so our first responders need equipment too. If you have equipment, and it's sitting around your house and you're wondering, when am I going to ever use this stuff, please think about finding a place for that, and we can help provide a way to get that to the needed places.
So for those of you that might be just joining, I just want to confirm that if you have supplies, personal protective equipment that you are not using, masks, gloves, even unopened hand sanitizer, Mercer Island Pediatrics will accept your donations. Please call ahead, though. Let's make sure this is coordinated and we keep things safe. And if they do not need those supplies, they will be sure to pass them along to those that do. Thank you for helping us with that. Now, just before we started our presentation today, we had some late-breaking news about telehealth and what folks can expect from their providers and insurance companies.
Several weeks ago, before this got too deep, we started looking at the possibility of telehealth, but it turns out that the insurers really haven't gotten a way to manage this yet. Governor Inslee signed a bill just a week or 2 ago that would provide what is known as parity, equal pay for a telehealth visit as you might be paid as a provider for a face-to-face visit. People don't want to come to the doctor now, and yet in many cases they need to come, or they feel they should have their child or themselves seen. But there hasn't been a good infrastructure for being able to pay for that. The breaking news is that, well, a week ago, Regents Blue Shield said, we're going to do it. Before we're going to be forced to do it, we're going to do this. And I have to applaud them for being willing to make that move. Medicaid has been doing it for a while. The breaking news is that Mr. Inslee has signed a proclamation indicating there will be parity, equal payment for telemedicine visits, just like there are for in face-to-face visits. Prior to coming over here, I did 2 of those. I fumbled my way through the first one. I'm not a techno kind of guy, but the second one went very well, and it was a very good experience, I think, for both the families and for me.
So this is providing me a great sense of relief that if my family or myself has a need, we are moving rapidly within our state to provide telehealth services. Thank you for that update. Mm-hmm. Just as a reminder, if your insurance company has not gotten there yet, give them a call and encourage them to do so. All right, Dr. Quinn, everybody wants to know about the status of testing for COVID-19 in our community. What can you tell us about your experience and your practice and what you know from the emergency response perspective?
Okay. So that's been one of the big issues as well on some of the conference calls I've been on. Although testing sounds like it's maybe more widely available, it isn't that available, as a matter of fact. And furthermore, if a test is done, in some cases there can be a significant delay in getting the results back. Before I left the office today, I saw a fairly sick kid 8 days ago. We still did not have the test results back. By now, that kid's playing. He's perfectly healthy at this point, but we still don't know what his COVID-19 results are. And so, despite it sounding like it's more available, you're seeing the drive-through testing sites. There's a backlog at the laboratories, and so we're still having some delay in getting some of those results back. I personally believe that we're at a point in this crisis that routine testing is not necessary. There's debate about that. There's still some epidemiologic value in knowing how many people have this. And some exciting news as well is that very soon there are going to be kits that are going to be available for the consumer. As part of the conference call last night, it turns out that this type of swab we do in our clinic, which is, it looks a little bit like you're getting a brain biopsy, to be quite honest, through your nose, and it feels like it because I've had it done before, not recently, by the way, but that doesn't seem to be as necessary to go far back in the nose to get the test done. And so it looks like that there may be a direct consumer test that consumers can do themselves, or possibly do in a drive-up site where the consumers can do that, and it won't be as uncomfortable. We're excited about that possibility. But nevertheless, at this point in the crisis, I don't think that routine testing is necessary. We test people who look like they're sick enough to need to be hospitalized, and there's many reasons for that. It turns out, as a matter of fact, though, that many people who walk into hospital and look like they have this disease, their test turns out to be negative, and it's something else. There's still, again, influenza A and other viruses circulating out there. Consider, at this point, everyone has been exposed. That's a pretty good likelihood, and treat them like that, which means keep your social distance. Make sure you keep yourselves appropriately apart from everyone. One of the things that we've been talking about in our emergency meetings for the last 3 years, and Officer Franklin and all the folks who've been leading those discussions talk about the first job in an emergency is to make certain that you and your family are safe. Once that has been determined, reach out to your neighbors and find out how can you help them. The Map Your Neighborhood is one of the initiatives that we've tried to go through our city to get people to get to know their neighbors. The National Night Out is a wonderful way to do that. August, we'll be done with this in August, I hope. We'll see. But nevertheless, hopefully we'll be able to congregate by August, hopefully sooner. Nevertheless, treat everyone as if they've been exposed, keep your distance, but just take care of yourselves for sure. There are a lot of examples of people who have been reaching out to others, and I've been reading about those on Nextdoor, in the Mercer Island Reporter, and also in the anecdotes that I'm hearing from other people. It's been pretty amazing to hear that. Please give thanks to all of those who are continuing to have to work through this. I've talked to a number of people who aren't working, and they're about to go crazy. They wish they could go to work. But for those that are working, they are exposing themselves to this virus day in and day out. I'm talking about our grocery store clerks. I was taking advantage of my senior shopping opportunity this morning at the QFC. There's a lot of toilet paper down there, by the way. The pharmacy employees, our food delivery people, our city staff, and particularly our first responders who put themselves on the front lines of this battle every day.
Thank you. So, Dr. Quinn, before we let you get back to your day job, I did have an email come in with a follow-up question from a parent. I think it's something that's on all of our minds. Our children, particularly the younger children, don't necessarily understand fully what's going on, although we're doing our best to explain. We also have children that are really struggling, like the adults are, with anxiety around this issue. And in just a moment, I do have some slides on the counseling services that the city provides. But not to put you on the spot, I'm going to do it anyway. What advice can you give us about talking with our kids?
Thank you so much for asking that question. And I have to admit, I told you earlier, my daughter is a psychologist and was actually interviewed on the news about the same question and had some great ideas. I think to some extent, first of all, try to keep some sense of normalcy and of scheduling in your households. Try to have the same schedule every day if you can. That's difficult when they're not in school, and also when the scenario changes from day to day. But if you can have some sort of structure and schedule, children need boundaries. That's the first thing I tell parents when their kids are little. Children feel safe by having boundaries. So make sure they have structure in their day and they're continuing along that way. Keep them busy with chores. One of the big issues with being out of school right now is the opportunities, and I've been hearing about these from some of my families, about some life skill learning, teaching them how to cook, how to clean their rooms. We do this already, I'm sure, but try to give them some things to do, keep them busy and occupied. Take advantage of good weather when you can be outside. I think that's great, but again, play dates are really challenging right now. Public Health Department is saying let's keep that to basically none, if at all possible. Make certain that when you're talking about your own personal stressors, take that into a separate room. If you're talking to your spouse or your family members about stressors, children don't understand what they hear adults talking about. They sense our tone when we are worried, when we're anxious. And so if you can not let them hear your stress, that will help them feel less stressed. Let us see what else. I think those are probably some of the most important ones at this point. This type of crisis can bring out the best in humanity, and I forgot about, of course, my Mr. Rogers quote, but I still love that quote, and some people have said it's somewhat trite, but look for the helpers. Mr. Rogers said that when he was scared, when he saw something scary, his mother would tell him to look to the helpers. I see a few of them out in front of me here. They're going to be speaking to you in a few moments. And one more thing, turn off the television. The news is on nonstop, and there's so many, it's just blaring over and over again about this, and that is, at some point, either they'll just begin to ignore it, or it might begin to scare them. And so if you can just avoid having them watch the news and all the stuff that's coming out, I think that may be helpful. So I think I would avoid excessive media exposure under the circumstances. It doesn't really help them at all, I don't think, to get used to this. This type of crisis can bring out the best in humanity, and it can bring out the worst. Please be patient, practice loving kindness, and we will get through this.
Dr. Quinn, I just want to say thank you so much on behalf of the Mercer Island community, not only for serving as one of our favorite pediatricians, but also in your volunteer role as a medical director. And we appreciate you taking time out today to join us. We are doing live briefings Thursdays at 3 o'clock for the foreseeable future, so we'll stay in touch. I'm sure there'll be additional information that would be worth sharing with our community. Thank you again for joining us.
Thank you so much.
All right, we're going to transition topics here, and the next update is regarding Mercer Island emergency operations. And what I wanted to do today was make sure that you, Mercer Island community, have a sense of what's actually happening behind the scenes. So don't worry, as you see this slide come up, you're thinking, oh my gosh, you're gonna talk a whole bunch about emergency management. I'm not, but I do want you to be aware of how we operate. All agencies, including the City of Mercer Island, are working under the National Incident Management System, also called NIMS. This is a federal construct. It means that we're all on the same page. So whether you're a county, a city, or even a volunteer agency, we all work under the same framework. We partner with King County Emergency Management. Our operating structures are integrated. This is very important. This is how the city keeps going, and we coordinate with the region and the state. We have made, as a city, consistent investments in training and emergency preparedness, and I want to assure you, the Mercer Island community, that your staff are trained. We are all in new roles right now, and we have been practicing this for more than a decade. We are prepared, and we are responding and taking action swiftly. And you should be proud of this. We are part of one of the best emergency management networks in the nation, and I'm not just saying that, we've actually won awards. So be proud that you're part of a well-coordinated emergency management system. We have an emergency operations center. We call that the EOC. We are currently activated at level 1. Level 1 is the highest activation. What that means to you is all of our city resources are currently deployed for either the emergency response or to provide essential functions. Non-essential city services are suspended. That's not only for good reason, because our resources are tied up with the response, but that's also per the governor's order on Monday. The city is now fully operating under the EOC organizational structure, and I'll tell you what that means in just a moment. The picture on this slide is our emergency operations center. We can see is the few times a week that we do gather, there are usually 5 of us or less in the room, and we're sitting at tables far apart. Everybody else from the staff that's participating in this response is actually doing so by phone. So we have quickly modified how we operate, even our EOC, to ensure we stay safe and we can continue providing you services. So what I wanted to make sure I explained to you today is that the city organizational structure that you knew last week, we were organized as a city manager and a number of departments, is all suspended right now. We're operating under the EOC Organizational Chart. Don't worry, you don't need to study this, but I just want you to be aware that the city reorganized quickly. I'm still the city manager, the last time I checked, but the response is now being managed by Emergency Manager Jennifer Franklin. So she sits in that box at the top of the page. We still have people running their departments, but they are organized differently. So we have 3 main sections. The operations section, which is now headed up by Jason Kittner, our Public Works Director, and he's managing things like Parks and Recreation, Public Works, Youth and Family Services, and even some of the police and fire functions report up through Jason now. We have a planning section. This is still being led by our emergency manager, Jennifer Franklin. These are folks that are handling situations as they arise, doing all of our paperwork, doing necessary research, documenting everything, planning for the long-range response. And finally, our biggest section is the logistics section, which is being led by Zach Hoovener and Elaine Summergren. This is where finance now falls, human resources, timekeeping, and the very, very important task of supply procurement. So I wanted to explain how we're operating now, because the services that you normally receive from the city are coming through different channels and have been reprioritized. I need to give a shout out to the staff. If any of you have been through a reorganization in your life, you know it often takes days, months, long time. We fully restructured in 48 hours. So we made the call Monday to fully restructure, and we had the new structure implemented on Wednesday. It was a lot of work, but my thanks to the staff for executing and doing so with a lot of grace and patience. Within our EOC, I mentioned this just a moment ago, all of our city's supply procurement now runs through our Emergency Operations Center. We are coordinating with the region for supplies. Our top priority, which shouldn't come as a surprise to you, is personal protective equipment. Our first responders, and that's our police and fire teams, are considered Tier 1. That means when personal protective equipment becomes available through the state, federal resources, the county, those supplies first go to Tier 1 folks, so police, fire, and our healthcare workers. All of our other city functions that may require personal protective equipment fall into a much lower tier. And I wanted to remind you about this because this is one of the reasons our operations are limited. Certainly the governor's order also limited operations, but we can't afford to burn supplies on non-essential functions right now. I need to give a shout out to the Sandstone Distillery in Tenino, Washington. They have converted their operations to produce hand sanitizer for first responders and medical professionals. And we actually went to Tenino this week to get hand sanitizer for the City of Mercer Island. They're providing it to us for $20 per gallon. I know nothing about making hand sanitizer, but I'm going to hazard a guess that it's costing more than $20 a gallon to make hand sanitizer. So thank you to them. They are manufacturing per CDC guidelines. And Mercer Island, I'd like to ask you to do me a favor. They have a Facebook page. Go give them a shout out and say thank you on behalf of the community for what they're doing. It really matters. By the way, the picture there of the police officer and the police car is not our car or our officer. We forgot to take a picture, but they're providing resources to the entire region. So thank you again, Sandstone Distillery. Something else I want to share about how we're operating is this week we deployed a 3-member policy team just to tackle all the policies and potential code changes that we need to address as part of this emergency. And it's a wide range of actions. There could be new policies or emergency policies that we need to take action on. Some cases we need to modify how we're operating. We may need to suspend some policies that just don't make sense right now. And the other thing, and this is in the category of work smart, do nothing and don't enforce. So I'll give you an example. We have a plastic bag ban here on Mercer Island, and a number of you reached out and said, hey, can we suspend this? I honestly didn't want to take the staff time to suspend the policy, but what I can tell you is we're not enforcing it right now. So I know, for example, Walgreens had to recently move to using plastic bags. That's just fine. I don't think it's essential for us to go and change that policy. We have other higher priority things we're working on. So what you need to know about this policy team is we are rapidly responding to changing orders and directives. They're coming from the federal government, the state, and even in some cases, the county. We appreciate your patience as we work through our changing operations, and we will continue to notify you, our community, as policies, procedures, even codes do change. I wanted to let you know we recognize in this emergency that the city, we have so many phone numbers published and different ways to access us. So we are in the process of transitioning to a call center. So there is now one phone number that you can call for COVID-19 related issues or anything else. That number is on the screen, and it is 206-275-7626. The call center will be open Monday through Friday, 8 to 7. We will expand the hours if we need to. There is also now an email address, coronavirus@mercergov.org. Moving to a call center function is something that we're doing to streamline our operations, and because we're planning on a long horizon for this response. So over the next week or two, many of our phone numbers will now be feeding into the call center, and we're redeploying staff to support the call center. All right. One of the main questions that we've had over the last really 4 weeks is how many cases of COVID-19 are on Mercer Island. We do have some data now. On Mercer Island, as of yesterday at about 1 o'clock, we had 21 confirmed cases of COVID-19, and one person has unfortunately passed away. This information is available on the Public Health Seattle and King County new dashboard, and in just a moment I will show you what that looks like and the link. I want to remind you, as Dr. Quinn stated earlier, that people with symptoms of COVID-19 are being asked to quarantine by their healthcare providers. This is whether they've tested positive or not. Quarantines are voluntary. We had this question earlier. There are no mandatory quarantine protocols in place. And also, as Dr. Quinn noted earlier, many people are still not tested. Okay, so when you go to the, I mentioned just a moment ago, Public Health Seattle and King County has launched a new dashboard. It launched yesterday, and the traffic to their website has been so high that the website has periodic interruptions. Fortunately, I was on the site yesterday and I grabbed this screenshot. So as you're looking at this data, I want to remind you it was from yesterday at 1 o'clock. I was not able to get on and get a screenshot from today for this briefing. So what you'll see, particularly look down where it says positive, there are over 1,300 cases in King County as of yesterday. Now, when you go to this dashboard, if you hover over the map and you particularly hover over Mercer Island, a box will pop up and it looks like this. This now shows the number of cases in our zip code and if there have been any deaths as a related to COVID-19, excuse me. Something you should know about this dashboard is there's a backlog of data entry. As Dr. Quinn also mentioned earlier, tests are sometimes, the results are delayed. So Public Health, and I give them a ton of credit for getting this dashboard propped up, is working furiously to get the data updated, and we will continue to monitor this. So what does this mean for you? I think we're still at a place where it's very important to practice social distancing. You'll remember this graphic. We've seen it all over our social media sites. This is from the CDC. It's been broadcast on news channels. We are working to flatten this curve, right? This is why all these measures are in place. So we now have, again, back to the dashboard, we now have a curve that we can monitor for King County. And I want to remind you, there's a little box here, if you go to the dashboard, that that indicates that public health is still working to get the data entered. It is not fully entered yet. But we now have a way for those of us living in King County to monitor how we're doing. Are we flattening the curve? So what you'll see, the screenshot again was taken at 1 o'clock yesterday. The blue line is the total number of cases. Okay, so that's going to rise. The gray boxes that you're seeing, those are the total number of people tested. And the blue boxes below are the confirmed positives. Again, data is still being entered, especially the last few days. There's a data lag. Public Health is working to get the website stabilized due to the high volume of traffic, and we will continue to monitor this. We think that having data is absolutely essential right now so that we can modify our protocols and our response. So my compliments to Public Health, Seattle and King County for standing up this dashboard for us. I know it took an incredible lift. Something else that I feel it's really important to talk about, and it actually came through as a request from several citizens, is now that we know more about the cases in our area, and we know we have confirmed cases on Mercer Island, it's a reminder to respect individual privacy. Viruses don't discriminate. Although this originated in China, that does not mean that everyone that is from China has a disease or has a propensity to contract this virus. Coronavirus does not recognize race, nationality, or ethnicity. Somebody wearing a mask when you're out and about in the community does not necessarily mean they're ill. In many cases, people are wearing masks because they're immune compromised. This is something they're doing to protect themselves. You play a role, a very important role, in interrupting the stigma of this by sharing accurate information and by speaking up when you hear something that's inappropriate. We encourage you, and you heard Dr. Quinn say this earlier, be compassionate during this time. This is a period of very high stress and anxiety for some, particularly those that may be suffering from COVID-19. And we also ask that you respect individual privacy. There is a reason we do not know where these cases are. It's because we need to respect people's right to privacy. Okay, I'm going to transition now to Governor Inslee's Stay Home, Stay Healthy order. Just a reminder, on Monday, the order came out, and it basically says everyone in Washington State should stay home unless they are pursuing an essential activity. There are some things that are defined as essential, including grocery shopping, visits to your doctor. It bans all gatherings for social, spiritual, or recreational purposes. And it closes all businesses except essential businesses. There have been some clarifying information coming out about essential and non-essential businesses, and I think that will be the trend we'll see going forward. We are posting all of this information as a reminder on the City of Mercer Island Let's Talk page. Okay, quickly now, we have a number of city services updates for you, and we'll try to be swift with this. The first thing is that the City of Mercer Island ourselves, we sat down on Monday actually it was on Tuesday, after the governor's order to review our essential services and make sure that we are in compliance. So things that we deem essential are emergency response, including things like legal and communications, certainly police and fire, and the two chiefs are joining me today, roads, utilities, mental health services, of which we do provide through our Youth and Family Services Department. Some parks functions are limited, and then internal services. We have to keep human resources, finances, facilities, and our IT networks running to support things like police and fire. Most of our non-essential work has been suspended, although there are a few exceptions when some of the work can be done from home. So at this point, I am happy to turn over the presentation to Fire Chief Steve Heitman for a fire operations update. Chief?
Thank you. Good afternoon, Mercer Island. Steve Heitman, your fire chief. Pleased to let you know that currently the Mercer Island Fire Department is still at full staffing. We do not have any personnel off related to COVID-19 nor any confirmed exposures. We still have the 2 confirmed patients that we have transported, and we have suspicion of transporting a few more since the last time I updated you, but we have not gotten any results, nor are we likely to get so because they were from private residences. Just to let you know, the Mercer Island Fire Department admin staff is transferred over to telecommuting as much as possible to try and keep everyone safe, to try and limit the number of people coming in and out of the building. We've stepped up our wellness checks that happen daily. Everyone that it comes into the building is required to check their temperature right as they come inside the door. And we're now doing that 3 times per 24-hour period, 5 times total for those that are working a 48-hour shift. We're also having them track any signs or symptoms they may have had related to this, just like we are the citizens, whether or not they've had a temperature, flu-like symptoms, body aches, chills, vomiting, diarrhea, anything along those lines. Currently, we have 2 skilled nursing facilities that have had patients test positive for COVID. Those have been identified, and we know when we're responding that that is a high-risk premise. One thing to keep in mind is that 80% of those who contract COVID-19 do not need treatment in the hospital, which is good news. We're starting to see patients, though, as we go respond to calls out into the other part of the city that have tested positive for COVID-19. And because of that, you will see us regularly wearing our PPE on all aid calls. We are going with the mantra that everyone is COVID-19 positive until proven otherwise. One of the ways that we're doing this is we are sending in a scout. It's the first person in who will try and interview from the doorway if they can. They'll start asking the patient questions. They're in full PPE related to the questions I already said earlier, including if they've been around anyone who's been sick or if there's anyone else in the household that is sick, because those questions have been missed a couple of times, and we've had some close calls in other agencies. Once that's determined, then we'll let the rest of the crew know what level of PPE they need to go to. The exceptions to this are when we get a cardiac arrest. Everyone automatically is in full PPE so that there is no delay in our treatment. A couple of these facilities as well, we've responded to for automatic fire alarms. Doesn't help when we go into an automatic fire alarm just wearing PPE. Therefore, you'll see the crews up more often in their full bunker gear, including their breathing apparatus. That way they are protected from the virus itself, and those are easy to decon as well. We're currently keeping a very close eye on our stock of PPE, and we inventory that a couple times a week. We're also sharing that information at the regional level so that the supplies, as they're dwindling in some areas, can be shared equally among all of the responders, including healthcare facilities and the private ambulance companies. As I said last week, the fire station lobbies are locked. That does not mean the fire station is closed. If you need to have the crews see you or you have business there, we ring the bell, the crews will answer that door. The things we're not doing are the simple services such as blood pressure checks. Spending a lot of time on webinars. I've learned a lot about Zoom and other platforms where we're having meetings. I'm on conference calls every day of the week, both at the county level, at the regional level, at a national level. There's a lot of information going around. There are a lot of other areas that are being hit much harder than we are. And I'm getting a lot of phone calls for finding out the experience that we've had and the policies that we have drafted in order to deal with this epidemic. We're also collecting a lot of data through our records management system. King County EMS and the Department of Public Health have access to these records, and they're doing a great job of collecting that information so that we can learn from this and better prepare for the next time this happens. One of the things to update was from last week, I realized after some feedback that I received on the hospitals that we really don't have a good way to know where the hospitals are as far as the patients and how many beds they have available. There is a system called WATRAC that I now have access to, but it doesn't quite provide the information we need. And so fortunately, I posed this question yesterday on one of the conference calls and found out from King County EMS that Microsoft has dedicated an entire team to this problem. And so it should not be long before we're going to have real-time access to know which hospitals are seeing a surge, how many beds they have, and what they can handle. As a reminder, you're going to see the numbers continue to move upwards. It does not necessarily mean that the disease is getting worse, although we do know more people are catching this. We are just getting better at the testing. We're getting more test kits, and so we're getting a more accurate picture of how prevalent this is. And again, remember, this is going to be a long-term event. We're going to be dealing with this for several months. We're hoping that we'll be on the backside of the curve and on a downward slope by August. As of today, there are 49 locations within King County. Most of those are skilled nursing facilities that are listed as high risk. So we're seeing that number grow every day, and we're actually getting to the tipping point where we may not report this out anymore. We just may consider every facility as high risk. Thankfully, the Department of Health has put together the dashboard that you saw earlier. Again, we've only had 2 cases reported to us officially. But thanks to that dashboard, we now know that there are 21 on the island. Not that we need to know who they are, but it just is good to know the prevalence, and it gives us that higher alert for knowing that we may be responding to somebody who has tested positive. We're still learning things every day about this virus. We know now that it is not considered transmittable by aerosol, but it does hang in the air. It's living on surfaces longer than they had predicted. So we're doing a much better job of cleaning things down at the fire station. We now have an electrostatic disinfecting machine that we're utilizing for all of the rooms within the station, within the aid cars and the apparatus that we use to respond. Testing is still limited, as Dr. Quinn alluded to. If you feel that you are sick, call your healthcare provider and see if you can get a test. There are testing sites going up for first responders that we've been able to utilize, located in Shoreline, Seattle, and there will be one opening up shortly in Covington. I also know that there's a DMAT team on the ground, and they're going to be opening up field hospitals, and they're hoping to get upward of 1,000 beds within the county. These are not going to be designed to handle COVID patients. They're going to be designed to take the stress off of the hospitals and allow the hospitals to deal with the COVID patients. There have also been multiple municipalities who have made requests to set up their own testing sites out of frustration for the testing not being readily available. The Department of Public Health is discouraging this at this time so that they can coordinate this and conduct the testing and set those facilities up as allowed. Again, what can you do? Make sure you go on the Department of Public Health's website. It is a well of information. You are going to be able to learn a lot there, and it will answer a lot of your questions and take a lot of stress off of people. If you have symptoms and it is not life-threatening, stay home, isolate yourself. Go with the social distancing, which today I heard should be called physical distancing instead, so that people get a better idea they need to stay 6 feet apart. Do not go to the emergency room if you don't have to. We are making a lot of those decisions in the field. We'll leave you at home if we feel it's necessary, but if you need treatment, if you're within that 20% who need treatment in a hospital, we will certainly get you there. We will respond to all life-threatening emergencies. Keep an eye out for the symptoms that we've mentioned. If you feel like you're running a fever, or you have flu-like symptoms, body aches, a cough that is productive, a runny nose that keeps going on and on, if you have any of those signs, then you may have COVID-19, call your healthcare provider or call 911. Also, make sure that you share your symptoms with the dispatcher if you do call 911. That way we can be better prepared when we show up to see you. Please follow the governor's stay at home, stay healthy proclamation. There's a lot of people out and about. Getting fresh air is good, but there's also a lot of congregating still going on. Make sure that you are maintaining that distance. Make sure that you are maintaining personal hygiene at home. Wash your hands. Soap is a fantastic item for keeping those your hands clean. Make sure that you're cleaning all of those high touch point areas within your home using a disinfectant. There's also been a big ask on donations, and included in the presentation, I've put a couple of links to the websites that you'll have access to. King County a lot of the donations are being focused there, so that especially for masks or gowns or anything along that line, they're collecting all of that so that they can distribute it out. The Medic One Foundation is also taking donations. They've got a page up for a gratitude meal, and what they're utilizing those meals for are those people that are staffing a lot of these facilities that are being set up. that don't have access to that. So if you want to help, make sure you check out some of these sites, and there's a number of other things online. And again, remember, this is a dynamic situation we're going to be in for a long time. Thank you.
Thank you very much, Chief Heitman. And now I am pleased to introduce again Police Chief Ed Holmes. Chief?
All right, good afternoon. Ed Holmes, your police chief. And I wanted to spend a few minutes to let you know what's going on with the police department. Our officers are continuing to follow safety protocols as we've talked about. We're doing self-screening when they come to work. I mentioned before we had 2 officers who did not feel well. I'm pleased to say they got tested and tested negative for the virus. We are also, to the extent we can, we're telecommuting. Now, last week I mentioned that the criminal element is still out there. There are scams going on. I've seen other warnings for such things. And speaking of crimes, I was on the phone this morning with a conference call with the King County Police Chiefs Association, and we were all really disappointed to hear Bellevue reporting that they have members of their Asian community who are being targeted, being blamed for the virus, being targeted, and actually being threatened. Some pretty horrific threats made. And I guess my message here to the group is, as an association, as your police chiefs and the sheriff's office, we are united in our clear message that this is absolutely not acceptable, and we will investigate these hate crimes. So if you are the recipient of such a thing, please call 911 and we will respond. I want to spend a few minutes now talking about the governor's stay-at-home order. We, as your police department and the police departments across the state, we really are on the same page in wanting to really focus on education. We want everybody to understand the order. What does it mean? We want to comply and have everyone comply with the spirit of the order. There are 4 broad categories for permissible essential activities that are identified. 1, obtaining necessary supplies and services. 2, engaging in activities essential for the health and safety of families. Number 3, caring for or transporting family members, friends, and pets. And number 4, engaging in outdoor exercise activities. There's also mentioned the order of employment. Employment is okay for essential business services, and there's a list on the governor's website identifying what those are. We have had some questions lately here in the community around commercial and residential construction. The governor did issue a clarifying memo last night, clarifying that, but with some few exceptions, construction is not authorized. So a lot of the questions I've been hearing are sort of what I would call in the category of what if. What if this, what if that? And upon looking at those, I'm realizing I can't begin to answer every one. They get little, quite nuanced sometimes between the 2 questions. So I guess I would say to the community, the operative word is reasonable. And so police officers, we use that reasonableness standard when we apply the law to anything in our everyday activities. In the police academy, they speak to that word a lot, doing that which is reasonable. So our goal really is to educate rather than issue criminal citations. And so if you're not sure of an activity, if you've looked at the list and you're not sure, ask yourself, does this seem reasonable? And if you look at the spirit of the order, again, the spirit of the governor's order is to stop the spread of the virus. So I really am hopeful that residents here can understand what it means to reasonably try to stop that spread. Be distant, make sure you're separating yourselves. And I would say this, as a general guideline, if you're in doubt and if the issue you're wondering about is not urgent, err on the side of staying at home. It really does literally save lives if you can stay at home and separate yourself. So again, your police department will be looking to do a lot of educational pieces. We don't want to have to issue criminal citations. If it comes down to that, we can. It is a gross misdemeanor to violate a governor's order like this. But our sincere hope is we don't have to go there. And I will trust that this community will certainly have a common interest in stopping the spread. So my expectation is that maybe but for a few reminders, you don't see the police involved with this enforcement activity. Thank you.
Thank you very much, Chief Holmes, for that update and those helpful reminders. I'm now going to quickly run through some service updates for the rest of the city. I have some slides on small business support, and then at the end, a call to action. So for those of you that are in the queue for permits from the city or maybe looking out to future permitting action, I will let you know we are still accepting permits, but we've stopped issuing approvals and or the accompanying notices. I need to let you know that the governor's order last night clarifying that residential and commercial construction is not essential came late in the evening, and we're still working through our processes. So I will commit to you to having a more detailed update by next Thursday, and we will certainly be updating our website. There's a phone number on the screen for questions on permits, and you can also email us at epermittech@mercergov.org. Project review. Another question we've had is, hey, you've got a number of big projects in the queue that were supposed to be open for public comment and hearings. One of them is the Jinghua apartment complex in the town center, for example. So again, what I will tell you is we are continuing to accept mailed and emailed comments on major projects. We are continuing our technical staff review of our major projects on a very limited basis. And this could actually scale back even further because some of our planning department staff had to be deployed this week to support the emergency response. I just mentioned, and I'll say it again, we have suspended issuance of permit approvals and notices. There will be no public hearings in April. So for those of you that were emailing and asking about the Jinghua project, for example, we will have no public hearings in April. And I think it's very unlikely that we will have public hearings in May. I mentioned earlier, we just got notice from the governor clarifying the status of construction last night. So at next week's briefing, we will provide a more comprehensive update on the status of projects, where they're at, and what you can expect. And I want to assure you that the city has no desire to be taking action on anything right now. We're busy on the emergency response. So really, most of this work has stopped. Our municipal court is operating on a very limited basis. The physical court closed on March 13th. We do have court staff available by phone. We will have no jury trials in the months of March or April, and we'll be rescheduling everything that was canceled, including the court hearings. We do have a webpage for our court if you want more information there. The thrift shop, unfortunately, is closed now due to the governor's order. This retail operation is not considered essential. So we are no longer accepting donations, but please, please, please hang on to them because we do envision a day in the hopeful near future that we can resume our operations. I know many of you have reached out and said this is a significant loss of revenue. What are you going to do? You're right, and we're working on that right now. As a reminder, the Mercer Island Thrift Shop helps fund the Youth and Family Services Department. And I believe, don't hold me to this, the gross revenue is somewhere around $160,000 a month. We are still accepting donations, the Mercer Island Youth and Family Services Foundation, and those donations are going directly to supporting families impacted by COVID-19. Counseling services are available. We encourage you, if you're somebody in need, any age, to call our intake line. And that number is published on the screen. It's also available on our website and our Let's Talk page. This is a confidential phone number, and we are working to return calls within 1 business day. Our food pantry is open on a modified operation. The food pantry is open Tuesdays, 10 o'clock to 1 o'clock, and Thursdays, 1 o'clock to 4 o'clock at the Mercer Island Community Center in the Slater Room, which is the room that's right outside the entrance. Or you can schedule an appointment by reaching out to the Youth and Family Services Department. Our school mental health counselors are working, and I've called this modified because schools are not open, but you can reach out to any of them for your child's needs, and they are happy to support you remotely by phone or email. So thank you to our school counselors for continuing your work during this very uncertain time. Senior Services, many of you have had the good fortune of working with Betsy Zuber, another one of our very talented Youth and Family Services staff members. She is working and can help you with senior service needs. We also have financial and food assistance available. And the YFS staff are staying in touch very intentionally with the seniors that have been clients of ours in the past. So we are doing everything we can to keep this community group connected. Parks are open and limited. Over the weekend, we closed playgrounds, we closed the tennis courts and sport courts, and we closed the picnic shelter at Aubrey Davis Park. Parks remain open for passive use, provided you can maintain a safe and consistent 6-foot distance from one another. And we have some fun graphics there on the screen. You'll see Leap the Frog up there in the left-hand corner. Per the governor's order, no gatherings are allowed, and we are actually reducing park maintenance. Landscaping and routine maintenance are not essential services, so you'll see us pulling back on that work. We will continue to do safety work in the parks and of course provide sanitation services, cleaning restrooms and emptying garbage cans. Our recreation department is operating on an extremely limited basis. I think we're down to just one employee at this point. Check out our Facebook page, Mercer Island Parks and Recreation. I know they've put out a call for photos of Mercer Island community residents recreating safely under the governor's order, and you can send those to Katie Herzog. We also want our seniors to stay connected and accessing resources. So we've published a couple of web links here that may be helpful. Mercer Island City Council meetings. We will have a council meeting on Tuesday, April 7th. And I just want to mention, I know you're not seeing your city council members right now, but they are just an incredible bunch of leaders, and they are working furiously behind the scenes right now. I think I mentioned at the last briefing that I'm reverse delegating things to them. So as staff are needing help, we reach out to our council members and they are taking action. So my fantastic thanks to them for their incredible leadership. We will be getting together on April 7th for a city council meeting. The start time may be changing, so stay tuned. We'll get that announcement out. I do want to let you know what you can expect. Per the governor's order, we cannot hold an in-person public meeting. We will have the meeting streaming live like it normally does on our YouTube channel and on channel 21. And the purpose for our business is very limited per the governor's order. It's only things that are routine and essential or things that are related to COVID-19. So you will see a very focused agenda on April 7th. And as I mentioned earlier, all of the other project work is suspended at this time. All right, quickly, and I'm sorry to keep this till the very end, here are some things that you need to know about supporting our Mercer Island businesses. First of all, small business disaster assistance is now available to all Washington businesses. And by the way, I'm not going to read through all of these slides. We've posted all of the information on our Let's Talk pages. For those of you operating small businesses, there are low interest loans up to $2 million for working capital now available. Small businesses, nonprofits of any size, small agricultural cooperatives, which may not be relevant to Mercer Island, have been financially impacted since January 31st, and the Small Business Association is working hard to provide you with resources. Supporting our local businesses during the stay home, stay healthy order. There are a number of businesses that are continuing to operate, and we encourage you to continue we encourage you to consider supporting them. For example, actually, I'm sorry, these slides changed order from the last time I looked at this. If you are a business and you're not sure of your status, you can confirm whether or not you are essential. by going to the websites listed here. Again, all of these links are on our Let's Talk page. If you are performing an essential function and you have been deemed otherwise, you can also petition for a status change. Food pickup zones. Many of the restaurants reached out to us and said, hey, it would really be helpful if we had a zone where people could pick up their food orders. We are working on this. We deployed a pickup zone for Mia Posto and Einstein Bagels. I believe it was either yesterday or today. If anyone else is interested in exploring a pickup zone, and there are some limitations in terms of where we can put those, please reach out to Sarah Bluevass, and her email is on the screen there. We have on our Let's Talk page a list of restaurants that are available for delivery, and a reminder that every dollar you spend on the island is an investment into the Mercer Island community. So please consider a takeout meal when it's appropriate for you. Other friendly reminders, now is the time to buy gift cards or prepay for services. This helps our businesses continue to operate, shop online, shop local, and please promote our businesses through the channels that are available to you. Again, Sarah Bluevass has been assigned during this emergency to be the small business liaison, and she's happy to support you and help you with your business needs. And finally, a campaign that's launching in partnership with the Mercer Island Chamber of Commerce is Takeout Tuesday. This is your opportunity, not only just Tuesdays, any day of the week, to support our restaurants by considering a takeout order. So please join. And for those of you that are social media inclined, we encourage you to promote and celebrate our small businesses. Okay, I'm in the home stretch here. I have a few more updates. Utility resources for you and some things you should know about utility assistance. Our clean water and safe drinking water is an essential service. We understand that some of you are impacted, whether you're a small business or you're a resident, and you're worried about paying your bills. To avoid these undue burdens, the city will be implementing the following policies. City water service will remain on throughout the duration of this emergency. The city will not disconnect customers for non-payment during this time. We will be working with customers who have been financially impacted by the coronavirus epidemic. We will not be charging late fees to customers that are unable to pay their bills on time. We are happy to arrange for a payment plan and encourage you to reach out to us to do so. The city's utility bill reduction program is available to income qualified households, also providing access to discounted utility rates. So if you are a small business owner, a resident, you have a utility account and you need assistance, we're happy to support you during this time. One final reminder that we have other emergency assistance programs available to you through our Youth and Family Services Department. We can support you in your time of need for food, rent, other utilities, and any other needs that may arise. Cheryl Manriquez in our YFS department is your primary contact for those services. All right, my last few slides here, I promise. Mercer Island call to action. So many of you have reached out and said we would like to help. So I have some very specific things that we need you to do. First of all, if you are able to donate blood, there is a critical crisis right now at the blood bank. A desperation for blood donations. This is an essential service. It is something that is allowable, and it's an opportunity to get out of your house. Bloodworks Northwest is no longer taking walk-in patients. You do have to schedule an appointment in advance. We encourage you to consider donating blood during this time. We also encourage you to consider your efforts for neighbor-to-neighbor support. We want to make sure our seniors, our high-risk population, and anyone else that may be in a vulnerable category are taken care of throughout this emergency. But we also want to make sure they are safe. If you have a personal relationship with a neighbor or friend in this community, please reach out to them today and next week and do so consistently. We are concerned, as the Chief Holmes mentioned a moment ago, about crimes of opportunity, and we would feel better if people were helping their neighbors in a safe way. We are working with groups like Red Cross on opportunities for volunteer support, and we'll mobilize as needed. Just a reminder, if you are listening to this message, if you have a need that is not being met, please consider reaching out to our call center that we just started today, and we would be happy to connect you with resources. The Mercer Island Youth and Family Services Foundation, I mentioned this just a moment ago, is continuing to accept donations. Those donations are available to families impacted by COVID-19. And with the closure of our thrift shop, your donations now, if you are able, are more important than ever. We are also continuing to accept donated gift cards. And if you come into the City Hall parking lot, we have a brand new secure box where you can drop off cards. We prefer $25 or $50 denominations from New Seasons or QFC. And you can also, if you'd prefer not to leave home, you can mail them to Youth and Family Services. All right, and finally, I want to give a shout out to the Mercer Island Preschool Association. They are promoting a campaign, something that we can all do from home. And this is called A World of Hearts. It's easy. You just display hearts on your windows and doors. And that way, when people are out for a safe walk, they can see your beautiful artwork. I attempted, not very successfully as I can now see, to take a picture of the hearts in my windows at home. However, it looks like the screens were in the way. Anyway, this is a great way to get your kids involved and active at home, and I look forward to seeing all your hearts on your windows. A final reminder, we have a call center that we stood up today. If you need something from the city, if there's anything we can do to help, please do reach out to us. We continue to promote our partners' websites, including King County's page, the public health page, the school district page, our Chamber of Commerce, and the Center for Disease Control. We will continue to do these briefings every Thursday at 3 o'clock until further notice. If you have questions or specific topics you would like us to address, please send them to the city manager email address, which is citymanager@mercergov.org. And as you heard today, the slogan is stand together, stay apart. I think it's a fitting way to close our briefing today. Thank you for joining us this afternoon. Be safe.